living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Sometimes when it comes to good health, one of the biggest factors is your gender. And it's probably no surprise to anyone that evidence supports that men and women's brains do work differently. Welcome to Healthy Living for Life. I'm Beth Brown, your host. Today we're going to talk about a very important topic, good mental health. Stay with us. We'll be right back right after this. Welcome back. Joining us today is Dr. Eric Arzubi, a board-certified psychiatrist and an advocate for good mental health. Thanks so much for being with us today, Dr. Arzubi.
Well, it's my pleasure. Thanks for having me.
So let's start out by talking about what we mean when we talk about mental health illness or conditions. I'm sure that's a lot. Can you just give some of the big ones that kind of fall under that umbrella?
Sure. So, when we talk about mental illness, I also want to make sure we talk about mental health, right? So they're kind of two sides of the same coin. And so, there are two ways to think about this. One, you can promote good mental health, which is something I think we should all aspire to and hope for, really. And then there's mental illness, which is really the way to define mental illness is when either the absence of mental health or an impairment in mental health. And ultimately, you can divide those into lots of different diagnoses, but the big picture sort of categories tend to be mood disorders, anxiety disorders, psychotic disorders, personality disorders, among others. And you can also include substance use disorders, as those tend to travel together.
Okay. And we know that in this country, about 1 in 5 Americans will experience some kind of mental health issue over the course of their lives. That's a significant number of people. And yet mental health issues still carries kind of a stigma. Why do you think that is? Why do we still have such an issue with talking about our mental health?
Sure. And in fact, I might even, if you allow me, I might even actually kind of tweak that number. So the way it actually works is 1 in 5. So 1 in 5 people at any one time can be diagnosed with a mental illness. So for example, if we were to take a snapshot today of the entire population, 1 in 5, or about 20% of the population, would be able to meet criteria for mental health diagnosis or mental illness today. But it turns out over the course of a lifetime, the chances of anyone in the population developing a mental health disorder or mental illness is actually 50%. So 50% of the population will at any time in their life develop what's a diagnosable mental illness.
Okay. And so why do you think we are still uncomfortable talking about these issues?
Yeah, thank you. Sorry, I lost track for a second of that question. But because the difference, we hope that we can talk about mental illness in the same way we talk about physical illness. But the difference between mental illness and physical illness is, and again, I'm not sort of telling you anything that's sort of original or any one of my original thoughts, and I just kind of see this over and over again, is that our state of mind is related to our identity, right? So in other words, if let's say I break an arm, I'm still Eric with a broken arm. But if I have anxiety, now am I still Eric? Is my identity switch? I think there's a threat, right? Because we change the way, if a mental health problem changes the way we perceive the world, then that really is sort of a threat to our identity, and people are scared of that, right? So for example, if I'm going along and my mental health is good and I develop an anxiety disorder, I view the world differently. I start worrying more than perhaps the world warrants, and that's sort of the definition of an anxiety disorder. And so it changes the way I see the world, and that's a scary thing for anyone. I get that, but it's unfortunate that the stigma persists because, again, it's something that is many mental illnesses are treatable.
Okay, well, thank you for that. And you just mentioned anxiety disorders, so let's talk about that a little bit. What are some of the different types of anxiety disorders?
Sure, I'll give you a sort of a short list. Again, not entirely exhaustive, but some of the common ones can be generalized anxiety disorder, social anxiety disorder. It can be panic disorder, agoraphobia, and specific phobias. So being scared of particular objects or items that are very specific, like somebody could have arachnophobia, fear of a spider, but that's also an anxiety disorder. And over time, the definition or the categorization of anxiety disorders have shifted. So, for example, PTSD or post-traumatic stress disorder used to be classified as an anxiety disorder, and now it's listed as a separate trauma-related disorder than before.
Okay. And I think it's important to note that it's okay to feel anxiety. That's a normal, natural, people get nervous, worried. How do you know when it's crossed over to something that you might need help with? When does it become an anxiety disorder?
That's a great question, because this comes up a lot in all sorts of diagnoses in psychiatry. For example, if somebody has struggles paying attention for a little bit, struggles to concentrate, it doesn't mean you have ADHD. Or if you go for a few days of worrying, doesn't mean you have a disorder. And also, while 50% of the population will at some point meet criteria for a psychiatric diagnosis, it doesn't mean everybody needs medication, everybody needs to be rushed to a psychiatrist. The moment where, and this is true of any psychiatric diagnosis, when there is impairment in functioning, that's when it's a disorder. So I apologize, you might hear my Great Dane in the background.
No worries.
So when everybody feels anxiety at some point, no question, and in many times it's sort of situational. But when it crosses that line and it impairs how one functions on a day-to-day basis, for example, it impairs sleep, it impairs the ability to focus because there's so much worry, you struggle to actually complete tasks that are related to work or family or school. When it impairs functioning and you struggle to actually do what you are hoping to accomplish on a day-to-day basis, that's when it's a disorder. And that's when you need to think about addressing it.
Okay, and we just have a few seconds left, so this is going to be quick, and I apologize because it's kind of a big question, but if somebody needs help, then what kind of treatment can they get for an anxiety disorder?
Sure. So number one, first and foremost, I think the first line of treatment always needs to be looking at psychotherapy or counseling. But the type of psychotherapy has the best evidence for anxiety disorders is cognitive behavioral therapy. And that should be the first line. And in general, because people, a lot of people have ideas about psychiatry and psychiatrists and giving too many medications and so forth. And I get that, and because it can be a scary thing. But really, sort of a good rule of thumb is to consider if there's mild to moderate psychiatric disorder, then psychotherapy more often than not can really address those symptoms. And if it's moderate to severe, then you probably need to consider doing both. But I would, when possible, avoid taking medication without also having a counseling and therapy at the same time.
Okay, great. That flew by. We do need to pause here for a quick break, but we'll continue talking to Dr. Arzubi right after this. Stay with us. Welcome back. We're still talking with Dr. Eric Arzubi about mental health, and now we're going to focus on a topic that's very prominent in America, and especially in rural and frontier areas, and that's depression. So thanks for staying with us, Dr. Arzubi, to talk about this. So symptoms of depression. We know that women tend to be diagnosed with depression more often than men. Are the symptoms the same between men and women, or can they differ?
So in general, depression, the criteria for depression are the same for both men and women. And sort of the big ones are, for example, well, here, I'll just be very clear about kind of when somebody has depression, when they meet criteria for having a depressive episode. And so what is a depressive episode? Well, you need to have 4 or 5 symptoms of the following over the course of 2 weeks. For example, having depressed mood more often than not, lack of interest in doing the things you normally like to do, problems sleeping, either sleeping too much or sleeping too little, excessive guilt, sort of self-blame or feeling self-guilt that can weigh heavily, lack of energy, poor concentration, moving way more slowly than normal, or sometimes being super restless. And another one is having thoughts of wanting to be dead. So those are the criteria. So again, having 4 or 5 of those will basically mean that somebody has a depressive episode. And if they have more of those over the course of time, that really will mean a diagnosis of major depressive disorder.
Okay, and my understanding too is that hormones can come into play either during puberty or for women at menopause. Can you speak to that a little bit?
Sure. The difference. So there's a lot of research that will show differences in how frequently men versus women experience different disorders, including anxiety disorders, depressive disorders. And to be honest, the research isn't 100% clear and can tell you exactly why that is. So a lot of them are theories, but theories that make some sense, right? So it's in mental health, like many physical disorders as well, it's always a combination of genetics and environment, right? So because someone who is born with a family history of depression doesn't automatically mean they're going to be depressed. In the same way that somebody's born with a complete clean bill of health in terms of their DNA doesn't mean they'll never have anxiety. It's always a combination of your genetics and your environment, and that's what comes together to either create health or create illness. But really, in terms of the depression and the difference between men and women, certainly women have other risk factors that men don't have. Like you said, women will reach puberty sooner than men. And so that alone so coming into their sexuality and having sort of a flood of new hormones earlier in life than boys, that can put people at risk. And certainly pregnancy, that's something, I guess, speaking selfishly, thank God guys don't have to go through. Yeah. But I can't even imagine the flood of hormones, the stress of carrying that baby for 9 months, and forget the miscarriages that can occur, and then postpartum depression, and then the sense of responsibility that a mother feels. That again, mothers and fathers feel different levels of responsibility in different ways, and so. Again, being a woman different than being a man, and carries with that sort of different risk factors. And certainly going back to the other point is menopause, right? So these different life stage transitions that women may experience more or differently than men, right? Because men have also different life stage transitions, mm-hmm. but certainly I think they're probably more prominent or at least more obvious in women many times.
Is living in a frontier or rural area considered a risk factor?
Well, 100%. I think one of the things that's happening right now during this COVID pandemic is people are more isolated than before. And so that's kind of a little taste of what it's like to be more isolated than not, right? So in when we don't have the pandemic, people in rural and frontier communities are more isolated than people who aren't in those sorts of communities, right? It's more difficult to access healthcare, more difficult to access social encounters and social gatherings, and so those sorts of things certainly play a big role.
And we know too, suicide rates tend to be higher in rural or frontier areas. For folks watching at home who is either thinking about wanting to be dead, like you talked about earlier, or know somebody that they're concerned they're having those thoughts, what's the next step? What can that person do to either reach out to a friend or take care of him or herself?
Sure. No, there's and I hope, and again, I don't have the number on me, but there's a Montana warm line, there's a suicide hotline, and then there's a crisis text line, which is it's 741-741, that anybody with a cell phone can text that number and just say help or express whatever they're feeling, and a live person will actually text you back, and that's a national text line, which I think is. It's a wonderful tool because if you're in a situation where you really don't want other people to hear you when you're talking, again, because of that stigma, texting this crisis text line can be very useful.
Okay, and we can certainly put those numbers on the screen.
Yeah. Well, I apologize. The other thing I want to kind of mention about Montana too that's unique is we're one of the biggest states in the contiguous United States. With a low population density, right? So you have that level of isolation. And then, think about just anecdotally, do you think, are people drinking more or drinking less during this time of isolation? Probably more. If you talk to anybody who owns a liquor store, that's what they're seeing, right? So you have that addition to the increased isolation. Also, Montana has several populations who are sort of naturally at risk. For example, Montana's top 5 when it comes to per capita veteran population. Montana's top 5 when it comes to per capita Native American population. And then I believe we're number 2 or 3 when it comes to per capita gun ownership rate. And having access to lethal means makes it more likely that a suicide will actually be carried out. And so those are several of the risk factors that tend to be sort of unique to Montana, and certainly the geography and lack of access to care.
Okay, so knowing those hotlines is important. Okay, we actually need to stop for another break, but so far we've talked about anxiety disorders, we've talked about depression. Those are the top 2. After the break, we're going to talk about the 3rd most common when it comes to mental health issues. Stay with us, we'll be back after this. Welcome back. We're talking with Dr. Eric Arzubi, a board-certified psychiatrist. And next we're going to talk about another very common mental health issue, bipolar disorder. So Dr. Arzubi, thanks for sticking with us to talk to us about this. So statistics show that bipolar disorders affect women more than they affect men. Are the symptoms when you're looking for something like that in a man or a woman the same, or do those differ because of gender?
Sure. Also, great question. Clearly, it's hard to generalize and say, they're exactly the same in men and women. But really, the way we're trained is the criteria or the symptoms they look for go across genders. So, and just one thing I wanted to talk about when it comes to bipolar disorder. There's a broad category in psychiatry of mood disorders, and under mood disorders you have 2 types of depressive disorders. There's bipolar depression and unipolar depression. So there's that relationship. So what happens is in bipolar disorder, it turns out people with bipolar disorder actually have more depressive episodes and spend more time in depression than the flip side, which is mania. So in order to be diagnosed with bipolar disorder, one must have a manic episode. And the way manic episodes are defined or diagnosed are the same in both men and women. One of the things that sometimes does happen is bipolar disorders can be sometimes overdiagnosed because they can be confused when people have mood swings. Just because someone has mood swings doesn't mean they have bipolar disorder. In order to have bipolar disorder, there needs to be a full manic episode that has to last 4 to 7 days. If it's 4 days, it's called bipolar 2 disorder. If it's 7 days, it's bipolar 1 disorder. But mood swings alone doesn't mean you have bipolar disorder.
Okay. And you mentioned earlier a little bit about treatment for anxiety disorders. Is treatment the same for a bipolar disorder?
So good question. And at this point, it depends. Bipolar disorder, if it's true bipolar disorder, can be more impairing, let's say, than anxiety disorders. And so with bipolar disorder, if it's true bipolar disorder, you're more likely to work with medication at the same time as psychotherapy. So again, if you have someone with bipolar disorder, at that point, you're probably more likely to require a medication to help manage bipolar disorder.
Okay.
But psychotherapy is certainly indicated in addition to medication. I would say that's true pretty much across all psychiatric disorders.
Okay. So let's talk more broadly across psychiatric disorders. We've hit the top 3 as far as statistics show us in the country. But for those folks who are worried about loved ones, worried about themselves, are there sort of general symptoms that you can be on the lookout for or warning signs you should watch for that somebody might be struggling with some kind of a mental health issue?
Sure. And so a couple of things. I think first of all, sort of a change in functioning. And what I mean a change in functioning is change in the ability to carry out your day-to-day activities, either it means at work, at home, at school, with family. And so if there's a shift, a dramatic shift, or it can happen over the course of weeks or perhaps months, but if there's a shift and there's no medical, physical reason that this is happening, or there's no or even if there's a traumatic event, but then the effects last longer than perhaps might be common. So for example, if there's a death, we all grieve after death. It doesn't mean you're depressed and doesn't mean you have to have a diagnosis and be treated. But if that grieving process lasts longer than 6 to 12 months and continues to impair functioning, that's when you need to think about calling this a psychiatric disorder and perhaps seeking treatment. And I wanted to also take another step back and think about, a diagnosis helps the patient as well as the clinician understand a little bit about what's going on, or perhaps more than if we didn't have a diagnosis. But there's certain things that kind of cut across many disorders. So, for example, sleep problems. Sleep problems tend to appear in most diagnoses, and so sleep is critical. Getting enough sleep, making sure that you really nurture your ability to find sleep. Sleeping too few hours, or staying up late at night, playing around with your phone and eating into your sleep, it's a problem. So if someone's already at risk of having a psychiatric disorder, lack of sleep will make it worse and will increase that risk. The other thing is exposure to abuse, neglect, traumatic experiences in childhood is a huge factor. There was something called the Adverse Childhood Experiences Study that demonstrated that 2/3 of the entire population has been exposed to at least one adverse childhood experience, and about one in 8 people have been exposed to 4 or more adverse childhood experiences. And so that's a big factor. And so when you're trying to figure out, gosh, why does this person have a psychiatric problem, or why do I feel the way I feel, really thinking back to your family of origin. Not saying we can blame everything on our parents, but our families have a lot to do with the way we develop and emerge as an adult. And then certainly substance use. One of the things, I'll tell you, more and more people these days, because it's being legalized in lots of different places, smoke marijuana, and it's not benign. And again, I'm not on this anti-marijuana crusade, but I want people to understand that smoking marijuana, like many other substances, especially when the brain is still developing before age 25, can cause lots of problems, even though some people might feel it's benign. In putting substances in your body that affect your brain will affect brain development and make it more likely that you experience psychiatric problems.
Okay. All right. Those are good to know. Unfortunately, we are out of time, so we need to stop here. But thank you so much for all your expertise and your insight on that, Dr. Arzubi. We appreciate it.
It's my pleasure. Thanks for your time.
Thank you. And thank you for watching at home. We hope you'll come back next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. We'll see you next week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Production facilities provided by Video Express Productions.